My name is Mathew Thomas Alexander. I work as a neurosurgeon in Corpus, Texas at the South Texas Brain and Spine Center. Typically in my practice, we were pretty conservative. I would say less than 5% of my patients end up buying surgery. So 95% will get better with those treatment pathways. For example, there's a patient who has a neck disc herniation and they have numbness and tingling and weakness. That patient will try epidural injections with a pain management physician, physical therapy, and other medications. If they don't get relief after 3 months or 6 months or later, then we offer them surgery. So it's all different types of patients that we treat, from young to old. Unfortunately, we have a pretty big population that have diabetes, who are overweight. That causes more stress on the spine. You're getting older. Our aging population is much more, so their spine gets more degenerative. Other individuals we have are patients who are very hardworking. They work in the oil field. They're really doing a lot to their body, so they're advancing the stress and causing more problems on their body. So it's a huge, there's no age group that we do not do surgery for, and there's different techniques that we can do. For example, an older lady that has a fracture, we can put a small needle into the fracture, put a small balloon that creates a nice hollow cavity, and inject some bone cement. My part takes about 5 to 6 minutes, and they go home the same day, and their pain gets dramatically improved. They're happy customers. So in the middle, we try to treat patients through less aggressive surgery, and in that surgery we use smaller incisions. We use technology nowadays that are able to give us the same access as we did in the past. So through these small incisions, we can use dilators, we can use scopes. We're able to get down to the pathology and do less bone work, less laminectomy work. So the less you do, the less you cause trauma to the spine or the brain, and so that faster recovery time. It also decreases the risk of having further surgery. If you can not destroy the muscles and ligaments, that adds about 40% of the integrity of the spine, so it makes it stronger. So down the road, you have less chance of requiring a secondary surgery. Typically, I recommend always get checked out and get evaluated by a neurosurgeon. We're very good about tailoring a kind of a concerted route. So physical therapy, pain management. Sometimes I always try and match the pathology to their picture, so we direct where the epidural goes, what type of physical therapy is performed, because you don't want to waste your time and money and waste months and weeks or years to get better. So you come see us, we get a treatment plan for you and your life back.